Okay, so we are going to talk briefly about muscle relaxing injections or line smoothing injections, and there are different brands. And so usually for this, the main indications are the upper face, right? So this is Magda. Magda, you have not had it before, right? Any treatments like this before? No. Any Botox or similar treatments like that for the upper face?
No, not for.
And there are different brands, but usually we treat the upper face. Sometimes we can treat the lower face. So the main areas we treat are the frown lines. Can you just frown really hard? Okay, so Magda has really strong frown lines here, and there's 3 main muscles here where we need to relax to soften these lines, okay? Now, the other thing is the main second area we treat would be the crow's feet at the side. Smile. You can see here the little feathery crow's feet. That's easy enough to treat. And the third common area we treat is the forehead. So just raise up your eyebrows. Okay, now relax your forehead completely. So look at me. It's very tempting to treat the forehead lines here. One of the things that often happens if it's done wrong or badly is the brow drops or the brow looks heavier. So one initial very important rule is you have to be very careful with the forehead muscle. Don't over-treat it, and particularly in people like Magda, because she has this slight fullness below the brow, which can be quite a youthful trait, but sometimes this drops. If it drops even a millimeter, it's going to make Magda feel like her eyes are very heavy. So really important. I would argue that in Magda's case, we should completely avoid the forehead and not treat it, because if we do, she certainly will lose the ability to lift up her eyebrows, and this is not going to lift, and we want this to lift, if anything, rather than drop down. Now, sometimes for people who want a brow lift, and with botulinum toxin injections, we can induce a brow lift, non-surgical brow lift, and that's fine, but also the way we do that is to relax the muscles that depress the brow. So relaxing these ones here, the glabellar muscles, the muscles in the glabellar area and the crow's feet area and the tail of the brow, and avoid the forehead completely. Or if we want a lateral brow lift, which is just lifting the tail of the brow, then we can treat the central part of the frontalis muscle here and avoid the outer part here, so that we get a slight pull or compensation, and the outer part of the brow lifts like this. So one of the things that is often a telltale sign if botulinum toxin muscle relaxing injections are done badly is that the lateral brow peaks too much and it looks like a spock. It looks obvious that somebody's had Botox treatments. So the way we prevent that is we do have to treat a little bit in the outer frontalis muscle, the outer forehead muscle, because if we don't, it'll pull up too high. And we want to balance that with not dropping the brow. So this is like a balancing act, okay? So we can treat a tiny little bit above the brow in some people, or a little bit up further here, or sometimes both. And we also will usually treat the tail of the brow. That's to stop this creases that can appear above the lateral or the outside of the brow without the brow dropping down, because we don't want it to drop. So I would say that if you get muscle relaxing injections and the brow goes up too high and it looks like it's peaking a little bit, that's what I call it, then go back to the doctor or the injector who treated you and get a little bit more in here. That can be dropped. If the brow drops too much, it's very difficult to make it go back up. Of course, it will go back up if you wait, because all of these effects wear off over time. So those are the main things with the upper face, and we can sometimes treat the lower eyelid. Smile. Okay, these are less commonly injected areas. So there's a little muscle in the eyelid under here, and it causes a scrunching. That's called the pretarsal orbicularis oculi muscle. I usually inject right up under the eyelashes in the mid-pupillary line where the pupil is, not down further. If you inject down further here, what can happen is you relax the drum effect of the muscle, and you can get bulging of the fat pads and make it actually worse. So you have to be careful there. Sometimes we can inject above the lip. This is the orbicularis oris muscle, purse your lips, to treat the vertical so-called smoker's lines, but also we can get this kind of slight eversion of the upper lip, and that is often referred to as the lip flip. Other areas that we can treat are the depressors of your mouth. Do this with your mouth closed. Okay, now you can see this little triangular muscle here that pulls the corners of the mouth down. You can also see nicely the pebbling or the cobblestoning of the chin. That's the mentalis muscle here. Look this way. Yeah, so this is the mentalis muscle scrunching up, and this can be treated as well. This muscle out here can be treated, and What we need to avoid is the muscle between this one and this one, which is called the depressor labii, because if we relax this one, if open your mouth slightly and smile, what can happen is this muscle can go up like this if we get it wrong. So we have to be careful. We inject centrally and we inject very far out laterally to relax the depressor of the corners of the mouth. That's a really nice treatment that makes the corners of the mouth lift upwards, particularly when we do it in combination with filler treatments. Other areas we can treat are the masseter muscles, which is to clench your back teeth. Sometimes, and you actually do have quite a strong masseter muscle here. This is to reshape the face, or we can also do it in cases of bruxism or grinding of the teeth, and people who grind their teeth. And do this really hard, like grimace. And you can see here the platysmal band. This is the platysmal muscle, which inserts down the collarbone all the way into the cheek. These little bands can be injected as well, and it kind of relaxes the muscle slightly and alleviates the downward pull on the mouth as well. It's often referred to as the Nefertiti lift when we actually inject along the border of the jawline. But this muscle relaxing injection treatment is very subtle. It's not replacing lifting treatments like facelifts, which we do under local anesthesia, or face tight, or Morpheus 8, or all therapy, or all those other things. But it can complement the treatments. And it's all about synergy and treatments complementing each other. So I would say in Magdalena's case that the good areas to treat are the frown. Okay, so usually, just face this way. Usually we treat centrally in the procerus muscle, and then we're going to treat in the medial corrugator and a little bit in the tail of the corrugator here. That will relax this muscle completely and probably lift the brow 1 millimeter or 2, which would be quite nice. I would avoid the forehead altogether, and we can review her in 2 weeks and see how high the brow is being lifted. And certainly treating the crow's feet at the sides would be nice, a little bit of the tail of the brow, and maybe even a little drop in the chin, the mentalis muscle, and the depressors of the corners of the mouth. That'd be quite nice. So that's what we're going to do today. So here you can see different brands of botulinum toxin type A. There are many different types. They're all pretty good. The real key thing is the way it's injected and where it's injected. So the treatment itself is really quick, a few little quick injections, and there's a few simple aftercare things. My advice is you should use the muscles a little bit more than usual for about 2 hours. Avoid excessive exercise, alcohol, spicy food for about 4 hours. And then for the first 3 or 4 days, be very careful when you're cleansing the face. And I'll explain that. You should just gently cleanse upwards away from the eyes this way, and not over your brow this way, because in theory you could spread some of the botulinum toxin into this part of the forehead muscle, and as I said before, you don't want this because this will drop your brow, so you want it to stay high like this. So cleansing like this towards the middle of the forehead, and this area also cleansing this way away from the eyes and away from the cheekbones. If you rub down over the muscles here, this muscle here is called the zygomaticus muscle, which lifts the lip. So if you try to chase the crow's feet lines too much onto the cheek and put too much here, what can happen is you can inadvertently relax the wrong muscle and your lip can drop a little bit like that, or your smile will feel a little bit restricted, which you also don't want. So that's why we also alter the dose as we come down here. We inject more superficially, close to the surface, and a slightly less dose. So we're going to start with the procerus muscle. If you just frown really hard, Magda. Relax now. Okay. And we're just going to put some in the central muscle there. Frown, relax. Quite a strong muscle. This is the medial part of the corrugator. Frown, relax. The lateral or tail of the corrugator here is inserted into the skin. It's more superficial, so we inject close to the surface and not as much. Frown again, relax. And frown, relax. Very good, that's that. Now turn to the side. Raise up your eyebrows as high as you can. Now lift up your eyebrows really high. Yeah, now you can see here, this is a pulling here. So I want to inject here just where the frontalis muscle meets or blends with the orbicularis oculi. Now if you squeeze your eyes closed as tight as you can, scrunch, my finger is being pulled down. So this is the depressor of the brow. Relax now again. Little scratch here. Just a small dose there. Okay, and smile, big smile, relax, okay. Here we're just going to do a little bit down here. That's it. And you can see it's a very quick treatment. Okay, raise up your eyebrows again, relax. So I think what we'll get here is a nice, slightly lifted brow. Smile really hard and relax now. So these little feathery lines will completely disappear. It takes about 2 weeks for the full effect, so it's not an instant effect, but the muscles start to relax after about 2 days. Now turn this way, okay. Pull your mouth down again at the corners if you can. Yeah, relax. This is the depressor anguli oris muscle that we're slightly relaxing now. And stick out your lower lip. Yeah, now look at this dimpling, relax. We're just going to put a little bit here, not too much. Nearly done. And relax, pull down your mouth at the corners again, relax. This depressor anguli oris usually blends with the platysma muscle as it comes up here. So that is the treatment, and usually the effects last about 3 months, and if you do keep doing it over time, which most people do because they really like the results, then the results may last longer. Of course, you don't have to come back every 3 months, but if you really want to stay on top of the lines and keep the skin smooth and line free, then about 3 to 4 months usually is what we recommend for repeat treatments. That is it, line smoothing injections.